Bronchitis is a respiratory disease characterized by inflammation of the bronchial tubes, which carry air to and from the lungs. This inflammation results in coughing, mucus production, and breathing difficulties. Bronchitis can be acute or chronic, depending on its duration and underlying causes. While acute bronchitis is often short-lived and associated with infections, chronic bronchitis is a long-term condition that typically results from ongoing irritation, such as smoking or prolonged exposure to pollutants. Types of bronchitis. 1. Acute bronchitis. Acute bronchitis, also known as a chest cold, is a common condition caused by infections, typically viruses. It often follows a respiratory illness like the common cold or flu. Duration. Symptoms usually last from a few days to a few weeks. Causes. Viral infections, example influenza or rhinoviruses. Bacterial infections, less common. Environmental irritants like smoke or pollutants. Symptoms. Persistent cough, with or without mucus. Sore throat. Chest discomfort or tightness. Fatigue and mild fever. Shortness of breath in severe cases. Acute bronchitis often resolves on its own with rest, hydration, and over-the-counter medications for symptom relief. 2. Chronic bronchitis. Chronic bronchitis is a form of chronic obstructive pulmonary disease, COPD. It involves prolonged inflammation of the bronchial tubes, leading to recurring or continuous symptoms. Duration. Symptoms persist for at least 3 months per year for 2 consecutive years. Causes. Long-term smoking, the leading cause. Prolonged exposure to environmental irritants like dust, fumes, or industrial chemicals. Genetic predisposition in some cases. Symptoms. Persistent cough with thick mucus, especially in the morning. Wheezing. Shortness of breath. Frequent respiratory infections. Fatigue. Chronic bronchitis is more serious than its acute counterpart and requires ongoing medical management. Causes and risk factors. Causes. Bronchitis occurs when the lining of the bronchial tubes becomes inflamed, leading to swelling and increased mucus production. This obstruction impairs airflow, resulting in symptoms like coughing and difficulty breathing. Risk factors. Smoking, the most significant risk factor, especially for chronic bronchitis. Age. Acute bronchitis is more common in children, while chronic bronchitis often affects middle-aged and older adults. Environmental exposure. Long-term exposure to air pollutants, industrial fumes, or second-hand smoke increases the risk. Weakened immune system. People with compromised immunity, such as those with chronic illnesses or older adults, are more susceptible to infections causing acute bronchitis. Pre-existing lung conditions, conditions like asthma or emphysema can heighten the risk. Diagnosis of bronchitis. A healthcare provider typically diagnoses bronchitis based on medical history, symptoms, and a physical examination. Medical history. Questions about the duration of symptoms, smoking habits, or environmental exposures. Physical exam. Listening to lung sounds with a stethoscope to detect wheezing or abnormal breath sounds. Diagnostic tests, if necessary. Chest X-ray, to rule out pneumonia or other conditions. Sputum tests, to identify bacterial infections or signs of allergies. Pulmonary function tests, PFTs, to evaluate lung function, especially in cases of chronic bronchitis. Blood tests, to check for infection or other underlying conditions. Treatment and management. Treatment for acute bronchitis. Rest and hydration. Adequate rest and increased fluid intake are vital for recovery. Medications. Over-the-counter pain relievers, example acetaminophen or ibuprofen, for fever and discomfort. Cough suppressants, only if necessary, to allow sleep. Bronchodilators for wheezing or difficulty breathing. Home remedies. Steam inhalation. Honey for soothing a sore throat. Avoiding irritants like smoke or strong odors. Treatment for chronic bronchitis. Smoking cessation, the most crucial step to prevent disease progression. Medications. Bronchodilators to relax airway muscles. Inhaled corticosteroids to reduce inflammation. Antibiotics for bacterial infections. Pulmonary rehabilitation, a comprehensive program including exercise, breathing techniques, and education to improve lung function. Oxygen therapy, in severe cases where oxygen levels are low. Preventive measures. Vaccinations, annual flu shots and pneumococcal vaccines to prevent respiratory infections. Hygiene, washing hands frequently to reduce the risk of viral infections. Avoidance of irritants, minimizing exposure to pollutants, allergens, and cigarette smoke. Complications of bronchitis. If untreated or poorly managed, bronchitis can lead to complications such as pneumonia, infection spreading to the lungs. Chronic obstructive pulmonary disease, COPD in chronic cases, progression to severe lung disease. Respiratory failure, rare but possible in advanced stages of chronic bronchitis. Conclusion. Bronchitis is a common respiratory condition that can range from a short-term inconvenience to a chronic, life-altering disease. While acute bronchitis typically resolves on its own, chronic bronchitis requires long-term management to prevent complications. Lifestyle changes, like quitting smoking and avoiding environmental irritants, play a pivotal role in prevention. Prompt medical attention and adherence to treatment plans are essential for maintaining respiratory health.